Scientists finally have a weapon to fight the deadly Ebola virus, a vaccine developed right here in Canada.
The initial result is exciting. The initial result is promising.
The vaccine, called VSV-ZBOV, was designed by scientists in Winnipeg's National Microbiology Lab.
It is often referred to as the Canadian vaccine.
A clinical trial started in Guinea, Africa in March. Thousands were inoculated, and so far the vaccine is showing it works.
The data so far shows that none of the 2,014 persons vaccinated developed Ebola virus disease after 10 days after vaccination.
The approach: identify infected people, vaccinate anyone they came into contact with, then immunize the friends, families, and neighbors of those contacts. This is how smallpox was eradicated in the 1970s. It's called ring vaccination. Getting the vaccine to a trial stage had its challenges. In an extraordinary move, the World Health Organization sponsored it because it says no one else would. There's no profit to be made. Scientists in Winnipeg have been working on the vaccine for several years. Then, in 2010, the Canadian government licensed it to a small American pharmaceutical company. But it essentially sat on a shelf until that company entered into a partnership with pharmaceutical giant Merck in February. For those who have witnessed the dying firsthand, today's news is bittersweet.
Had this vaccine been available a year ago, I think it had the potential to save literally thousands of lives.
More than 11,000 people in Western Africa have died from Ebola since last year. It could be months before the vaccine is licensed and goes into full production. In the meantime, the WHO will continue to use what supply it has. Marissa Dragani, CBC News, Toronto.